So welcome to today's webcast. We do have a lot of information to share with you today, and we do expect to run for about an hour. Now, before we get started, just a couple of housekeeping items. Notice that your phones have been muted, and if you have some questions that arise during the webcast, you may submit them into the chat area that you see in the lower right-hand corner of your screen. All questions and answers submitted are going to be posted along with the presentation slides to our public wiki. And note that the webcast will be kept open for a few minutes at the conclusion of the presentation, just to allow for some additional time to submit questions. So as I said, my name is Becky Matias, and I'm a consultant here at Galen Healthcare Solutions. I've worked in healthcare for 24 years in various roles, with the last 6 years of my focus being Allscripts TouchWorks modules, with a lot of emphasis of everything Meaningful Use 1 and Meaningful Use 2. Tracy, want to go ahead and introduce yourself?
Yes, thanks, Beck. Good afternoon, everyone. My name is Tracy Kimball, and I've been a consultant here at Galen for about 4 years now. Prior to joining Galen, I was on the client side as an analyst for 5 years, and I have a lot of experience in application configuration, including the build for MU1 and 2, as well as charge note, order, and results. And thanks for joining us, everybody.
So our agenda for today's presentation includes defining HMP, or the Health Management Plan, what items you might find included in one, some basic components of the HMP, and of course the benefits of utilization. And we'll move on to reminders and orders, the differences, some types of reminders, and how to add them to a patient's chart. And we'll also cover some tips and tricks like we always do. We'll be taking a look at some of the preferences, and we'll wrap up with a discussion on how to leverage HMPs to meet a couple of MU2 measures. So let's get started with some of the basic functions. The Health Management Plan, or HMP, which you're going to hear us call that throughout the presentation, offers a singular location within the application to track patient testing and procedures in order to alert the provider when the items are near due or overdue. Now, in my mind, the biggest benefit of HMP utilization is the simplicity for the provider. And as quoted directly from the Allscripts documentation, the HMP provides a tool to prescribe and monitor periodic events related to a patient's health maintenance and disease management. And although neither tasks nor orders are generated from an HMP item, alerts are created when an HMP item is near due or overdue. Now, these may be viewed on the clinical desktop and in the encounter summary, and it creates a dashboard for the clinician to quickly review and act upon a treatment plan for current active problems and health maintenance issues. Now, I think that really succinctly sums up the functionality and benefits of HMP utilization. Now, as many of you are probably aware, this is basically a workspace that includes all of the patient's active problems, along with active orders, results, medications, and reminders linked to that active problem. The providers have the ability to view a whole picture pretty quickly, and of course they have the ability to take actions on problems and associated clinical items. So let's go ahead and make Tracy the presenter so that she can demonstrate for you directly within Allscripts.
All right, thanks, Beck. So actually, I'm already logged into our test system, and let's go ahead and get an application and just take a closer look at the HMP. So I've actually jumped into one of our test systems, and you can actually hit the HMP from a couple of different locations. First of all, if you're already in a note from the note authoring workspace, you can just hop over to the Health Management tab, and you can see all of the information there. Or if you're simply on the clinical desktop, if you're simply on the clinical desktop, the tabs here, depending upon your desktop configuration. I do like to work with this in a full screen view versus a tab view, simply because of the amount of information you might see on some of your patient's charts. If you're accessing a patient who has had extensive or long-term health care recorded on the chart, I think at first glance it looks like the HMP can be somewhat overwhelming due to the sheer volume of information that's on the screen. So if you scroll down through, you can see there's a lot of info here on this patient's chart. So to simplify things for the end user, one thing I like to point out at the very beginning when you're working with your end users or your doctors, it's important to keep in mind that the Hmp component only actually consists of 3 things. There are orders and results linked to the problem. Secondly, there's medications linked to a problem. And lastly, there's order reminders that are linked to a problem. So I think that kind of helps break down the busyness of the screen and makes the information more digestible to providers and end users. So let's actually take a second here and look at the options that are available in the Hmp component view. There are actually 8 selections that you can configure to display on the screen, as you can see here. So let's actually break down what's available for each view. If you select Health Management, the application will actually display a list of the clinical items linked to the patient's problems, including medications, results, incomplete orders, reminders, and other items, along with the associated problems. The contents of the Health Management view can be grouped by a couple of different ways here. It can be by problem, by my priority, problem type, or alert. So if you switch over to, let's say, problem type, and we collapses, you can see for some clinicians it might be that they need to look only at acute problems, or they only need to look at chronic problems, or maybe they're just really interested in a health maintenance visit, and they only want to see the things that are tied to the health maintenance diagnosis. So it's easy to do from this screen. Next up, we have the reminders option. The reminders and alerts selection allows for the display of any reminders or alerts that are associated with the selected patient in the data section of the component, which is down here. The contents of the reminders and alerts can be grouped a couple different ways. You can do it by problem, or you can do it with those that are just set up with alerts only. I've got one set up that's got an alert set on it. Next up is the Immunization Series. With this option, you will see the display of any immunizations received by the patient in context. The Immunization Series consists of 2 views right here. We've got our administered and recorded, and then our all statuses. And when you select the administered and recorded view, the application displays only immunizations that have been administered or recorded for this particular patient. Immunizations that are permanently deferred or temporarily deferred are displayed in accordance with some preferences that you can set. So if we come right up here, excuse me, we have our personalization. And we actually come over to Hmp tab. There are 2 main preferences that we're talking about here. There's our show perm deferral and our show temp deferral. As you can see, I've got both of these set to no, so that deferred immunizations are not displayed. So as you can see here, I don't have anything that's showing as being deferred. But take note, the display of problems and associated clinical items can be configured via this personalization screen so as to maximize end user satisfaction and streamline their specific workflow. If we switch over to the all statuses view, you can see I did actually have some items that were set for permanently deferred, temporarily deferred, and hold for administration as well. In this view, the application will display all the immunizations from all statuses, including those, like I just mentioned, the administered and recorded view, as well as the hold for administration, hold for documentation, permanently and temporarily deferred. But please be aware that the unverified or entered in error immunizations are never going to display in this view. Next up, flow sheets. This selection, take just a second, sorry. This selection allows for the display of a selected flow sheets using data from the patient's record. Really, flow sheets just enable clinicians to view patient data over time and analyze some trends that might be available. I've actually set up a dummy flow sheet here just to work. There we go. Flow sheets basically resemble spreadsheets with a simple row-column layout. The columns represent an interval of time, so for example, a day or a week, whereas the rows represent selected clinical data, for example, maybe vital signs or lab results. By grouping flow sheets and specialties, clinicians can access and manage patient data more effectively. Obviously, you're going to have your specialties here that are assigned to this specific user, and then based upon that selection, you can then pick the flow sheet that you want to use. Again, the available flow sheets are listed in the group by box. Flow sheets can be created using the Physician Admin tool or the PAT tool and are defined by your specific organization. I just created this dummy one here so we can just take a look at some few vital sign results. But for today's purposes, for this webinar, we're not going to go into detail on how to create flow sheets. That's really outside the scope of our conversation.
Hey, Tracy. I'm sorry to disturb your group. I'm sorry to disturb your group there, but we just got a couple comments. Is it possible you're coming off a little muffled? I don't know if there's anything you can do on your end to come off just a little clearer.
Is that better?
I don't know. Time will tell.
I'm sorry.
All right.
All right. Where are we here? Medication flow sheets. All right. If we pick the medication flow sheets, when this option is selected, the application displays the patient's centralized medication history in a flow sheet format. There are actually 4 options for display here, as you can see. You can pick the current, past, all meds, or just your med admin only if you prefer to have that. I'm going to change over here to all meds. I like this screen a lot because there's a couple things it does here. You can do 3 main things here from the screen. First of all, you can view the details of each medication, including, of course, the SIG, the associated problem, and the status of the medication. You can actually filter on a couple of different things. You can filter on medication, you can filter on problem, and you can filter on status. So let's say on this patient, we only want to see those medications that are associated with their migraine. Pretty easy for the provider to do that as well. Or maybe the provider only really wants to see, the filter. Maybe the provider really only wants to see those medications that are active. You can do that as well. And lastly, the thing I think is really nice in this screen is you can actually manage the medications directly from this flow sheet workspace, basically using the same context menus that are available in the medication component. If you actually click in this square here or in this cell, you can actually come down here, you can renew a changes, go ahead and DC. We need to create a new medication, we can do that right here from the screen as well. There's no need to bounce back and forth between screens. You can see everything at this one point. The next option is our education option. When this is selected, the application displays a table of all education delivered to the patient. There are no grouping options available within this education entry. However, you do have a lot of right-click options available. So actually including, you can go in, you can set up new education, you can DC education, you can do drug ed. Any of these things are available for you to go in and actually create and or modify education that's been provided to the patient from here. Next is your vital signs and findings. Basically, all this does is display the selected patient's vital data in a flow sheet format. Again, there's no groupings available with this. And similar to the education entry, there are some right-click options available. So you can come in and set enter in new vitals or enter an error and that sort of thing. You can also set up goals from this screen if you need to. That's an option. Again, it's just pretty much a display showing you over a long period of time what's happening with this patient. And the last option we have available is our normative growth charts. When this option is selected, the application displays the normative growth chart with the selected patient's growth vitals superimposed on standard or specialty data. That's going to be based on the patient's age, sex, and or special needs diagnosis when appropriate. And these standard options actually include your standard premature and your Down syndrome. With the standard, you have 2 options, the birth to 24 and the 2 to 20. The CDC recommendations are what are provided in the birth to 24 month growth chart, whereas the World Health Organization, or the WHO, data set is actually used for the 2 to 20-year-old. You also have an option if you've got a patient with a diagnosis of prematurity. That's available as well, and that uses the Babson and Brenda updated Fitton data set. It's commonly used in neonatal intensive care units, and it's basically used for the prematurity growth chart in TouchWorks. The patient must have a diagnosis indicating a premature gestational age of 36 weeks or less, or this option will not be available. So if I try to click that, it's going to say this patient does not have that diagnosis available. The last option is the Down syndrome option. These are converted from paper versions provided by the National Down Syndrome Society. Currently, there's really no electronic industry standard for Down syndrome growth charts, so these are the ones that they're using for this particular option. And there's a birth to 36 and a 2 to 18-year-old as well. So let's switch back over to the health management view. It's typically the default system view on the health management play and desktop component. And basically, this enables you to view and modify the health maintenance items for the selected patient. It displays an overview of what's being treated for the patient. These items are grouped by a couple different things that we talked about earlier. You can group by problem, my priorities, problem type, and alerts only. And it's just basically going to be dependent upon the provider or the clinician's workflow and how they want to set this as their default. But let's go ahead and take a look at some of these icons across the top here just to get started. They're pretty self-explanatory, but just to cover all our bases. Obviously, starting off the refresh view, the fresh icon does exactly what you would expect it to do. Clicking the refresh actually refresh the data within this the component down here. Next up is the flow sheet icon. It's used to display a flow sheet view with data from items the end user has selected. When problems are selected here, they're included in the ad hoc flow sheet along with any selected clinical items associated with that problem. So for this patient, if I actually select, let's say I select lethargy and maybe migraine, you can see not only did it select lethargy, but it also selected this B12 injection, selected migraine, that line item, and the 2 medications that are associated with that. But let's say I come down to the health maintenance, and maybe I don't want everything in the health maintenance. Maybe I only want it to be the CBC and this lipid. I come up and I flow all that. You can see a display of all of those values across a period of time with individual line items for those data points that are available. All right, next up is your graph. Just like you would think, when you click this icon to generate a graph with the data, the items that are selected on the component screen. Again, in this particular instance, let's say I pick this orthopedic surgery referral and I try to graph that. It's going to give me a pop-up that basically says, hey, you need to have more than one data point. We can't graph anything. So if instead we would choose this blood glucose option and then hit graph, you can see we can display the actual values across a long period of time for any blood glucose results that have come in on this particular patient. And finally, we've got the new task icon, which does, well, exactly what you would think. It goes ahead and lets you start to create a new task, and it'll just basically pull in the patient's, this particular patient's name and the concerning about patient field, maybe. There we go. So as you can see, it's already in there, and you can just go ahead and fill in as usual. That's really all we've got on the icons. All right. So next, let's take a look at the actual columns here. And I think sometimes this is where people get tripped up on using the Hmp. So a good rule of thumb when using this is actually move from right to left. So if we start over here with our incomplete column on the far right-hand side, if there's actually, if there's any action that needs to be taken on an item and there's an entry in this incomplete column, so let's say we're talking about our orthopedic referral, and we actually do a right-click function on it, you can see the menu that pops up gives us all the options that are available to actually go ahead and deal with this particular entry. So if we wanted to go in and say maybe we wanted to enter this in error, instead of actually having to go in and do all the details, just a simple right click will let the end user go ahead and modify that line entry. If the user needs to take action on an item and there's no entry in the incomplete, the next thing to do is to move over to the to-do column. Here again, a simple right click. Maybe it's this lorazepam or around the moxicillin. And when you do a right click on it, again, you've got all your options that are available within the medication component. Then moving on over. If there's anything available in the most recent, so let's say we are looking at you need to take action on maybe this particular on the lorazepam. You can right click Again, your options are available. There would be nothing in either of these other two columns. You can still grab it here. If the user needs to take action on an order reminder and there's no entries in the incomplete, the to-do, or the most recent, you can actually come over to the schedule column and right-click in there. So like in this particular instance, I actually have a reminder set up or a schedule set up for this B12 injection. So if I wanted to, I could actually come in and edit. I could see all the details on the specific SIG that was laid out previously. I could also come in, and change the schedule dates if I wanted to do that. Again, since we didn't touch on here, of course your item name is exactly what you think it is. It's item, line item for this particular patient linked up to the problem. Again, like I said, you can create a schedule. You can create schedules for medications and or reminders. Let's see, and then the select is just what you think it is. That's how you select items so that you can graph. One thing I think is really nice is you can actually come in and set up goals for the patient. So maybe we've got a patient who's had some blood sugars that have been a little elevated over a long period of time, and we want to set up a new goal. We can quickly do that. Maybe we want their blood sugar to be less than 120. And that way you can actually see it on the patient's chart that we have set up a goal for them and we have discussed with the patient where we want them to be in the future. One other thing I think that's really nice on the screen is actually this 5-year trend. It's just basically what's called a spark graph. These are basically going to display when you've got an item that has multiple results attached to it. It's just basically a small earnings that allows the provider to see trends in the measurements over a period of time, and it's going to go for 5 years. Again, we've already touched on what's the to-do and the incomplete. So I think, Becky, I think we're back to you. Let's see here.
All right, and I'm just going to go ahead and pick up here right at slide 12. And just so that you guys know, we are going to post a full slide deck of what Tracy just went through in her demonstration. And that was a really thorough demonstration, Tracy. Thank you. So let's talk about what's a reminder. So reminders, or Hmp reminders, are created from orderable items, but they're not yet in order in the patient chart. So it's similar to a Post-it note to remind the provider to order a specific lab or test or another orderable item. And there are differences between a reminder and an order. And in addition, there's 3 types of reminders. So let's just look in comparison at the differences. So reminders show in the to-do column, while orders show in the incomplete column. Reminders drop off the chart completely once they are executed, unlike an order. Recurring reminders, the completed reminder drops off and the reminder advances to the next to-do date. And results cannot be reported on reminders as they can for orders. And reminders cannot be performed or administered for like a medication or an immunization admin. So as we said, there's 3 types of reminders. There's the first one that we're going to talk about is called order reminders. They're created from an orderable item, except for that administration for meds and immunizations. And it is the most common, and many users refer to any reminder as an order reminder. So you really want to keep that distinction in your mind. Now for med admin and immunizations, it's created from medications and immunizations that require administration by a clinician. So an example would be like a B12 injection requiring a nurse visit to be scheduled. And then finally, there's free text reminders. And these were new to version 11. They provide the ability to create a reminder for anything that does not need to be linked to an orderable item or medication or an immunization. And an example might be the provider wants to remember to speak to a patient about a clinical trial or maybe a new medication is coming onto the market that might be beneficial.
Hi, Becky?
Yes.
Hi, sorry, I can't see your screen.
Oh, that's not good. Hold on.
That's not good.
Let's see.
There we go.
A little bit better? Sorry about that, guys. All right.
Great.
Okay, thanks, Jen. So let's talk about how to create a reminder from HMP. They're kind of redundant in the way the screens are. So since Tracy did such a thorough explanation, I'm going to refer back to the columns that she was demonstrating. So to do a reminder, you click on the to-do column, right-click on the line item, and then the reminders details box opens, which you see here on the slide, and you'd simply go through and complete those details. It's pretty straightforward. Now, if you're creating an order from HMP, you'd right-click on the line item, and you'd select Order from the context menu. The Orders Details screen opens, and you'd simply go through and create those details, and everyone is used to doing that in ACI. The order reminder from HMP is also pretty straightforward. You'd select the to-do column, highlight the exact cell for that associated order and result, and you'd right-click, and from the context menu, you'd select Create a Reminder and complete those details. Now, order reminders can also be done and entered directly from ACI. So here we have a screenshot of ACI, and you'd simply locate the orderable item, highlight it, right-click it, and select Reminder from the context menu, and then you'd enter the reminder details in the Health Management Reminder Details window. Now, order reminder from ACI continued. Just a couple of tips and tricks here on the next couple of slides. You want to leave the start date as it is when a previous result does not exist in the HMP view. And if a previous result does exist, it's going to show in the most recent column in HMP. And the to-do date for the reminder is calculated from the most recent result date plus whatever has been entered for a schedule. And finally, you need to keep in mind that if this is the first instance of an order, you utilize the Orders First Instance checkbox. The Orders Detail dialog will launch. The provider would complete the orders details, and then the reminder itself advances to the next to-do date based on the schedule that's entered. For medication and immunization reminders, you'd right-click from the to-do cell, right-click Order, select Schedule, go ahead and complete those details, and then save and close ACI. So I'd like to share a few tips and tricks. So you don't want to enter a start date in the future for a previously completed test not ordered by your provider. The best practice is to enter the historical instance as a record without ordering to have it documented in the patient's chart. The reminder will calculate from that date instead of entering a future date in the start date field. Reminders can be added to patient charts in bulk from population health management, and we'll be talking about that in a little bit greater detail. But when the reminders are added from population health, the start dates or the to-do dates vary depending on the presence of or the date of the most recent result shown in HMP. So HMP preferences, to access them, you go to TWAdmin, Preferences, and then select the drop-down for HMP. And they mostly control what items display in the health management view and how those items are sorted, very similar to what Tracy was showing us to personalize a provider's view. So the Hmp preferences, they're really straightforward in that their names and descriptions pretty accurately depict the functionality or behavior that's affected. As most of you on the call probably know, that's not always the case. Some of the Allscripts resources to help understand preferences are the ADBR, the Application Design and Behavioral Resource, as well as various reference and enhancement guides that can be found on Client Connect. Now, I did want to take the opportunity to point out, and you can see in the screenshot here, that the Galen Public Wiki has a really thorough page for preferences that includes not just definitions, but rather explanations of the decision points around configuration. We update this page to include the latest version's preferences. So instead of looking through several guides, you do have the convenience of everything being located in one place. I have included the link here on the slide deck for you, and I really encourage you to go take a look. So population health and Hmp. Pop health queries, they can be leveraged for adoption of Hmp workspace, as well as to help meet a couple of meaningful use core objectives. The ability to generate a list meets core 11, and with the creation of text reminders executed from within Pop Health or from the ACI through the free text reminder orderable items, it helps the provider achieve core 12 compliance. So text reminders are not associated with a particular order or medication. An example of how text reminders can be used are to remind a provider perhaps to talk to a patient about a disease management program. When they're added to the patient's chart, the text reminder is displayed in italicized text next to the patient's health management plan component. Now, there are any number of challenges associated with Pop Health. For example, orgs have decided what queries will be built and utilized. And in organizations and multi-orgs, there can be a lot of difficulty of varied specialties, also factors like security and performance, and due to those factors, it's usually a member of the EHR team that builds and runs queries. Now, putting a process in place to manage that is really important. And in an ideal world, the provider would run his or her own list, but that's not really what we're seeing happen historically. Now, many organizations have chosen to use those more generic types of reminders like get your flu shot, remind for mammograms, and basic health maintenance. And in this scenario, it's not been particularly relevant to a lot of specialties. And if you look at the screenshot here, you can see that there are many varied choices for running queries. With 2015 MU2 being one full year of reporting for a lot of organizations, we really are starting to see some conversations about how to develop population health queries that are really more relevant. And of course, if you'd like to have someone from Galen help you with your Pop Health plans, we're certainly very well versed in that area. Now notice that there is a physician on this slide. He's not just a cute graphic. And it's really important that as you shift from generic Hmp reminders to the more dynamic and perhaps more relevant Pop Health queries, this is really a great opportunity to engage those physicians in the discussions. Now, as the industry heads to pay for performance and value-based reimbursement models, Hmp is certainly an area of the application that supports that endeavor. And I encourage you to take a look at some of our recent blogs on this issue. We have some really good information out there. Now, on behalf of Tracy and myself, thank you for taking some time out of your day to allow us to share some of our EHR journey. We will have the presentation along with any answers to questions that were received posted to the public wiki in the next week or so. Thank you so much.